Kathleen Scotty Munning is our presenter. She received her bachelor's degree from nursing from IU School of Nursing in Indianapolis in 1987. She's worked for Wishart Hospital in Indianapolis, St. Mary's Hospital in Evansville, and of course, Memorial Hospital and Healthcare Center. She graduated from Indiana Wesleyan University with a master's in nursing April of 2017 and has worked as a family nurse practitioner at our Jasper Primary Care and also French Lick Family Medicine ever since. Scotty is also a faith community nurse since 2003. She's been married to her dear friend and husband, Joe, for 28 years. They have 2 adult sons, Joseph and Jonathan, and they enjoy kayaking, the outdoors, and cooking. And so with that, I will go ahead and turn over our presentation to our speaker, Kathleen Scotty Munning, on the topic of primary care.
Happy to talk with you. COVID is the big thing right now. It's changing every day for all of us. And with that, anything that we can't control tends to give us a little anxiety and a little fear. And so I hope that we can quelch some of that for you. From the aspect of primary care, some of the new things that we're doing to kind of help with the fear of being exposed to things, especially in our offices, we have been offering telehealth. Now, I want to tell you that all the offices under Memorial Hospital have instituted what we call trying to keep it a cold zone. So, we know someone has a high fever. They're not going to be sitting in our waiting room. We keep our patients separated as much as possible. It is mandatory. Everybody wear a mask. We know that this is our first and best way to keep ourselves safe and to keep our neighbors safe. So the social distancing, everything is a priority. So our offices are what we call a cold zone. We don't expect there to be a lot of active virus there, and we really go out of our way. All the staff wears protective personal equipment to keep each other safe as well. So we have our masks on all day. In fact, this is the first time I've had mine off today because no one's in this room with me. And I have to, when I'm meeting patients for the first time, when I walk in the door, I stay as far away as I can, take my mask off so they can see my face, and then I put it back on. I'm not sure which one is more scary or less scary, but that's what we do. So the people that are just super concerned about coming in at all, or maybe they're not feeling well and we need to check in with them, we've been doing telehealth. And telehealth means that we're doing it either over the phone or over a system that has a camera. Now, both options are set through a platform where we have a lot of security, because in medical care, we are always worried about your safety of your information and safety of you. So these are platforms that protect that safety. So we have to use certain things to do that. When I call people by phone, it's just our telephone directly to each other. If we do something where there's a picture involved, those platforms have some security put into them. So it's over the email. I have a lot of elderly patients that actually do quite well with it. Sometimes they have a son or daughter with them to set up the computer so we can see each other. And mainly the biggest complaints I have with that is the sound quality, or depending on the internet service, sometimes the picture quality. When you're preparing for this kind of visit, even if you're coming for a regular visit to see your primary care provider, it's always good to prepare yourself for that visit with having a list of questions. What are your top concerns for that visit? Why are you coming in today? What specific concerns do you really want to address that day? Okay. Always good to have your medications. Be aware of what your medications are. I'm going to ask you what you take them for. It's important that you know why you're taking things and for what prevention or for what alleviation that you're taking that. If you need refills or not, we'll take care of all those things at that visit. If it's a annual visit or a follow-up visit, we're going to address the things that you have chronic issues with and see how you're feeling with that. If there's something we need to tweak. If you have a way to check your temperature or your blood pressure at home, that's very helpful. And yes, of course, we like to know your weight. We won't share it with anybody, but that's what we need for what we need to do. But depending on what we're working with you, it's important to have those kinds of details. And then to go over your questions, we'll go over your questions that you have. Now, I don't know about you, but when I go see my doctor, and I love him dearly, I trust him, I've been going to him for years, we get talking and I forget something that I wanted to ask, and I'll walk out and go, oh, if I'd written that down, I would have remembered that that was something. Or he'll answer a question of something else I was concerned about, and I get kind of lost in all that, and I forget the other thing that I wanted to talk to them about. So it's always nice to have your questions prepared beforehand. And for these telephone visits and the telehealth visits with some type of video, that's even more helpful, because just getting absorbed in the technology and the newness of all this, we're all a little distracted and trying to figure out all those things. The most important thing with your care, though, is, we want to listen to what you're feeling and what kinds of things we can help you maintain or feel better about. Any information we're glad to give you. Usually a telephone call, believe it or not, is about 10 minutes. And that's a lot of time when you're just talking over the phone. It's different when you're in the exam room and while we're chatting, we're reviewing your laboratory studies or reviewing other things on the computer and doing your exam. By phone and by video, I can't really do a very good exam. Sometimes people can get close enough, I can see like a skin lesion or something they're concerned about in that way, but it's hard to make a really good assessment that way. But we do our best with that. If we need to see you, we're going to see you. Many of the providers are also providing some home visits if they have to, for people that are having a lot of concern that we just really need to get eyes and ears on you. And again, though, we'll remind you something of outer space, because we're going to have our protective gear on. We're going to have a gown or a white coat on. We got to have our gloves on. It's practice for me when you come into the office. I'll come in and say hi to you, wash my hands and dry them, put my glove on before I touch you, got the mask and all that stuff on, because we're close in your face, and so we want to protect you. And that's the whole reason we're doing that process. It's not just protecting us, but it's also protecting you. But some of that can be a little scary and kind of weigh on you. But I think if we kind of look at every day, one day at a time, and do the best we can with that, that's really the best approach that we can have right now with that. The second thing I wanted to talk to you about, so I'm going to tease Meredith. She put on there boosting your immunity, and I'd rather change that and tell you what I'd like to tell you is why good choices in what you do and what you eat are really important during a pandemic. Okay, eating healthy right now is very important, but hey, it's summer and we live in a great area. We live in this beautiful rural area with fresh fruits, fresh vegetables that you can get at any stand or whatever. So this is the time to really embrace all those things to keep us healthy. And being outside is okay in COVID, right? So you got your distancing and you're outdoors. You're less likely to spread things that way. So get out there and walk, ride your bike. There are wonderful things to keep you healthy. The other thing that I've been telling people a lot is to watch how much you're getting absorbed into the media right now, okay? We have a lot of changes with this COVID all the time. My concern with some people that are just so wrapped up in everything they can read and hear in the 24-hour news cycle is that there's a lot of negativity out there between the protests and the COVID. Some of that can really start to affect how you feel, how you interact with other people. It brings you down. So I would really caution you to limit that. If you have elderly parents, especially, it's a difficult thing. I was talking with one of my older patients who I just love dearly, and he was saying, we were worried about the Spanish flu. We were worried about typhoid and all these things that have come up. And as he was relaying all the things that he's lived through in his 90 years, it was pretty impressive. And then I'm like, well, how do you sum that up for the COVID? And he goes, yeah, you're right. We got through all that pretty good. And so I think collectively together, we will get through this pretty good too. It's just that now the mixed bag of blessing and challenge is how accessible everything is, be it through electronic devices, the internet, whatever. And so you really are going to have to act as a filter for your own mental health. And that in itself is going to help keep you healthy. When we're down and we're worried, it affects our health. It shows stress really can play on you and how you're feeling and how you're functioning. Stress makes you more vulnerable to getting ill. I have people with hypertension, diabetes, when they're super stressed out, that ruins their numbers. It makes life more difficult for them. So I highly encourage you to watch how glued you are to all the things that are going out in the media. You know, the news is good for reporting facts and everything, but at the same time, when you have a 24-hour news cycle, if you gave good news all the time, people wouldn't listen. You got to have something that draws them back. There are very good resources out there, and I'm sure Dr. Bunce is going to talk to you a little bit about that as well. But anything listed by the CDC and on the Indiana State Board of Health, those things have some good resources for people to look at and see what's going on. Any type of virus, you know, it's a small thing, and when we're in tight, close community, that's when things get spread. We know this, that's time-old stuff that we know. We're very blessed to be in this beautiful rural setting where we got some distance. I think most fear comes from our people that are working in tight, close groups, and thus the mask and good hand washing, making sure that you're drinking plenty of water. You know, if you're a smoker, I know it's not a good time to quit, but maybe cut back a little bit. But eating those fresh fruits and vegetables, getting outside, and trying to keep some positivity. I do tell people, you know, you bring a certain amount of energy to a space. And so what do you want that energy to be? Do you want it to be positive or negative? I have to laugh. I am almost 60 years old, and my mom, I remember as a kid, would always say, it's just as easy to think positive as negative. And I would get so upset with her because I'd be so upset about something that happened at school or whatever. I got thinking about it, and she's right. You can make that choice. Do you want to turn this into a silver lining, or do you want to be swimming in a sea of mud? And, you know, it's exhausting when you're worn down with that. And I don't want you exhausted. I want you well rested, and I want you to keep your head about the day and what's coming in as far as information for the day. That being said, I don't know how many of you are associated with a faith community, a church, a religious group, or whatever. So if you believe in prayer, this is a great time for that. There are things we can control and things that we can't. So from your perspective of this COVID thing, what are things you can control? Well, you can control your own personal social distancing of 6 feet, choosing to wear a mask, maybe not going out and doing all the things that you used to do, and being a little bit more judicious about the things that you want to. You can't control anything that your neighbor or another person is doing, but you can be a good example. You can't control this virus. We can't control this virus yet. We're trying, and we're trying to do it with very basic techniques as well as higher techniques that they're working on as far as immunization and such. But those things are kind of out of our control. Time well spent is being peaceful and thoughtful and a little prayer. So I highly, highly encourage you to seek out your faith community. You know, you can talk with people by phone, you can talk with people by FaceTime, but just that quiet time of some reflection and prayer is a good thing. And that does also help you stay healthy. Being a faith community nurse, mind, body, and spirit, it's a package deal. So we got to take care of all of it. That's really about the basics that I have. I don't of what I feel are helpful things right now during the pandemic, and I certainly look forward to any questions that you may have that I can answer for you today.
Question is, what are your thoughts on being retested after a positive test and quarantine has ended? The question goes on to say, if you suggest not being retested, how does a person know they aren't shedding the virus if they have received several positive tests but no longer have symptoms? And then it goes on to say as well that, you know, quoting the CDC, that I'm sure you know, that they have the following guidelines, you know, that you can, of course, be with others after 10 days after symptoms first appeared, 24 hours with without fever, you know, symptoms improving, that sort of a thing. So a longer question, but yeah, basically, yeah. What are your thoughts on being retested, I guess?
Okay. So when you're talking about retesting, if you're talking about the direct swab as opposed to this antibody testing, the swab, so we know the swab has got about 80% effective as far as false positives, false negatives. If you were tested positive for COVID, you are fever free, you had your quarantine time, we say go ahead. There are a lot of people that have absolutely no symptoms of COVID but have COVID. Okay. So I don't know what you want to do with the information if you retest. So whenever I'm getting a test, I want to know what you're going to do with the information you get. Does this mean you're going to stay quarantined forever until you get a negative test? Are you going to alter anything? So if you're following your best practices, you've had your quarantine and you're keeping your social distancing, you're wearing your mask, there's really nothing further to do. I don't know that testing is going to give you any more information. If you are in a situation where you're working closely in the factories or whatever, and the social distancing isn't probably as good, but you're doing the mask or whatever, that might be a concern. But if you're feeling well, you're fever free, you should be okay to go back to the normal things that we're doing. So the only reason that you would test is if for some reason you can't keep those normal precautions we're all doing. If you're feeling poorly, that's another situation. Every time somebody is in exposure to someone with COVID-19, you have up to 2 weeks to have that virus incubate and cause trouble. So symptoms may not show up for 10 days to 14 days. So you don't know who else you've been exposed to. So possibly we could test every day and have a positive test. So that's why we keep the precautions in place. So really think what you want to do with the information. I don't know that it's necessarily, if you're feeling well, a good idea to keep retesting.
Something else that others were wanting to know, because this is the first of our 3 in the series, they wanted to make sure, how can I continue to stay updated, on COVID, after all of this. Of course, I'm sure everybody knows that we do have our Facebook page. You could certainly get more information there. Of course, our website also, it's mhcc.org. Thank you. Also would obviously like to remind everybody, or take another opportunity to let you know that we do have those next 2 sessions that will come up. It will be August the 5th for infection prevention with Dr. Bunce. And then it'll be August 11th for the mental health portion with Melissa Leakin and Heather Trawiski. You can sign up for the class directly through Facebook, as I understand, our wonderful marketing department that's put all that together for us. You can also go to classes on our Memorial website as well. Got another question here for you.
Okay.
We want to know, what is the benefit of testing nursing home staff weekly if they could show positive up to 14 days after exposure?
Well, so, the nursing homes have come up with some different criteria because it's so high risk there. We have a very, very vulnerable population in our nursing centers, and they are trying to do everything they can to be safe for those patients. That's entrusted to a high level of care when your loved ones are being cared for 24 hours a day at a facility away from your home. Mm-hmm. So most of it is a safety precaution that they're doing. And they may actually glean some information post-COVID with this that I find interesting. So without going into too much detail, COVID is one of many forms of the SARS virus. So out of all of this, a lot of other study is happening, which I think is very appropriate. So there's many reasons sometimes in a facility like that we can also glean more information for future questions on things. So I wouldn't take that as just a safety precaution for the residents at the home and each other. You guys work so closely together there as well, and certainly appreciate all of our people on front lines taking care of our elderly in the nursing home. So it may not just be for the safety of here and now. It also may be towards some gleaning of information for future study, getting around this whole thing. It's a big piece that we're taking one bite of at a time. There's a lot to it. So, hang in there. I know it's frustrating, but sometimes there's more reasons for some of the things that we do than that are very apparent.
Very good. The next question we've got, Scotty, how long are antibodies detectable through a blood test?
So, we're not real excited about that blood test. The information from the antibodies is not, we haven't really decided what the information is we're getting from that test. COVID is so new, so every antibody is a little different. If you had your chickenpox vaccine back when you were 12, we can take a test and see if you're still immune by what's in there. This COVID is a whole new thing. Now they came up with this I think as a way to gather information and see if it helped us determine towards the vaccine and care and all that. I don't encourage the antibody testing. We just don't have enough information on how to interpret it yet. And so until that's all ironed out, I wouldn't go there.
Mm-hmm. Oh, very good. Thank you for that. Do you know, are there any statistics or additional information on how long the virus will stay with us after a positive test? You know, for example, how many weeks or months could a person realistically test positive after that initial test? You know, even if you're feeling better, no longer quarantined and all of that, how long would that actually show up if you had the ability to test as often as you like?
Yeah, I don't know that there's an answer to that. So in fact, I was talking with a patient the other day who was a student out east with one of the professors who's actually working on the type of test and what has the highest efficacy, be it an oral swab, a nasal swab, whatever. And so even those things are still getting ironed out. What is the best test? What is the best this? So I don't think anyone really has that information. If you test positive, is that because you have the antibody, or you test positive over and over? Is that because you're active virus? I don't think we really have those answers yet.
Oh, very good. Well,
very frustrating, not very helpful, but.
So then let's just really put you in the direct spotlight here then, Scotty, and ask you, what are your thoughts then on a vaccine? How do you feel about that?
So you have to remember that I'm of that age. I hate dating myself, but here we go. So I don't know if people remember smallpox. So that was told to our parents that a possibility that a certain number of us would die from the smallpox vaccine. And yet, because of what smallpox did to people, they lined us all up at school and we all got the shot and we all have that beautiful round scar on our shoulder and are here to live to talk about it. They are doing a test right now with a certain number of people in the vaccine. So, you know, we vaccine yearly for flu. I unfortunately got flu A this year. I still don't, because I swab everybody. I don't know how I got flu A this year because I had the vaccine, but I vaccinate every year and I will continue to vaccinate every year. And if they come up with a COVID vaccine, most definitely, since I'm a healthcare provider and I need to be able to take care of you, I'm going to take it.
We appreciate your thoughts and your comments on that. Mm-hmm. At this time, I think that we have actually wrapped up the questions. I would personally, though, like to thank Scotty for coming out today and being our very first of the 3 of the series. That definitely takes some courage to come out and speak to all of these people. But Scotty does continue to be a fountain of resource for not just me here at Memorial, but in our entire group. So we really do. I really want to thank her for being out here today. And if there are no other questions, we will go ahead and conclude our very first of our Zoom series on COVID-19, what now, what next? And we will look forward to seeing you all again next week.